Hi, my name is Katrin Moeseler, and today I'm holding my third speech, which is going to be about the health psychology, and it's my informative speech. Did you know that health problems are closely related to chronic disease, and further they're related to our behaviors and lifestyle choices that we make on a daily basis? As cited on the website of the American Psychology Association in 2010, reports of the Surgeon General indicate that the leading cause of mortality in the U.S. is have substantial behavior components. Health psychology is a very emerging field, and it links health with positive well-being. Therefore, that's such an important role in our daily lives. Myself, I'm a psychology major, and I have a concentration of clinical psychology, which I used to do some research on, and I'm also going to apply for a graduate program in health psychology in the fall semester. Today I'm going to first talk about the definition of health psychology, followed by the training, and I will continue then with the settings that health psychologists work in, and continue my my speech with the problems that health psychologists have to deal with on a daily basis. First, I'd like to start out to give you some more details about what health psychology actually is. There are two areas of health psychology. One is behavioral medicine, and the other one is health psychology. Health psychology dates back until the Greek civilization, and they already found out back then that mind and body are closely related. However, in the 70s, this field of psychology became more popular, and the area of health psychology became established. As I said before, behavioral medicine is the integration of behavior science with the practice of medicine. On the other hand, health psychology is a specialty area within psychology, and it's focusing primarily on the science and the profession in behavioral medicine. A recent definition that Brannon and Feist came up with, both of them are professors at the McNeese State Universities, and they hold a PhD in health psychology. They're the authors of Health Psychology, which got published in 2004, and they say that health psychology includes a psychologist's contribution to the enhancement of health, the prevention of disease, the identification of health risk factors, with the improvement of the healthcare system, and also the shaping of the public opinion with regard to health. Now that you know more about what health psychology is, I would like to continue to tell you more about what actually the requirements are in order to become a licensed health psychologist. You can either have a Bachelor's of Science or a Bachelor of Arts. However, if you have these two degrees, you can only work in a related field. If you want to become a licensed health psychologist, you have to go to graduate school for 5 to 7 years and receive a PhD in health psychology. At the end of your graduate career, you will have your own project of research that ends with a dissertation. After that, you become licensed. Now that you know what you need to do in order to become licensed, I'll let you know where exactly you can work as a health psychologist. Settings can be in hospitals. In hospitals, health psychology usually focus on the behavioral assessment of the patient. They can help with reducing smoking habits, or also help them to cope with their disease, or if they get diagnosed with a life-threatening disease. If they work in private practices, they most likely focus on linking the connection, or making a connection between the mind and the body. They also help to prevent disease and other problems that the patient have, and provide social support for their patient in order combined with the psychological adjustment. If a health psychologist work at a university, they are usually focusing on research, combined with teaching that they do, and also they would do counseling. A really big field where health psychologists are usually employed is in the prevention area. When they do prevention, they usually focus on preventing chronic disease, also working with patients on their diet and exercise habits, further with changing their behaviors and lifestyle choices, which leads ultimately to a change in their environment. Now that you know where health psychologists work, I would like to continue with my last point, which here I'm going to point out where or what factors health psychologists work with. According to Timothy Troll, who's a professor at the University of Missouri, Columbia, and who's also the author of Clinical Psychology, which got published in 2005, there are 3 possible factors that can cause health problems. These 3 factors are stress, behavior problems, and also their personality. I will start with stress. Stress can either occur if it's over a prolonged time, if it's very severe, and it can have effect on their hormonal system, their immune system, and also the autonomic system. This stress can further lead to impact the body organs, or have also function in regard to the mental function that it's going to decrease. Behavior problems is the second factor. And behavior problems could be lifestyle choices, which negatively affect their disease, or could also be smoking and excessive drinking, or a poor diet. The third factor, which is the last one, are personality, and factors could be or could result from disease, a process of disease, and which can ultimately lead to unhealthy behavior as well. Now I'd like to summarize my points again in order to conclude my speech. First, I informed you about the area of health psychology, which I started with a brief definition. Followed, I continued with the training requirements to become a health psychologist, followed by the settings where health psychologists work in, and I concluded my speech with the types of problems that health psychologists face. Now I hope that you have a better understanding of what exactly health psychology is, and also what health psychologists do. I hope you understand why health psychology is such an emerging field, and why it is particularly important for psychology.